Hi, I'm Marianne. I'm 59 years old. Had a heart attack in November. A few days before my heart attack, in the evenings, I started getting really super bad heartburn. Nothing would take it away. I would eat Tums. I take pantoprazole, which is heartburn medicine, and it wasn't working. Nothing was working. The heartburn wouldn't go away. I drank a bunch of water. Finally, it would go. It took about 45 minutes or so for it to go away. I had it every evening, and then at 4 o'clock in the morning, I woke up. I just had such pain in my chest, could hardly breathe because it hurt so bad. So I knew I knew something was wrong. I figured it was a heart attack. I have a lot of family history of heart disease. My husband drove me to the hospital. I went into the emergency room. Don't remember a whole lot in the emergency room, just that there was a lot of commotion. I remember having to chew baby aspirin. I don't remember them taking me up to the coronary care unit. I don't remember going up there. I remember waking up the next day. I slept the rest of the day that day. The care I got in the coronary care unit was wonderful. I loved the nurses and the staff. They were in there talking to me and making sure everything was okay. If you're overweight and you're smoking and you know you have it in your family history, it's a good idea to try and find someone to help you if you can't do it on your own. The sooner you do it, the better, because I waited too long. If I had done it maybe 20 years ago, I may not have had my heart attack. I may not have needed surgery. So if you're really serious about not having a heart attack or keeping your health, you have to get help if you can't do it on your own. And I would like to thank Sharon Regional and the Heart Association for allowing me this time to tell my story and to try and hopefully help give someone support out there. Thank you.
My story starts, I was golfing and I drove the ball. It was the 8th hole, and as I was walking to retrieve my ball, I started feeling chest pains, and the pain started to go down my left arm. It was pretty bad, but me being who I am, I decided to hit the next shot anyways, and that's when I realized this isn't a joke, this is serious. So I grabbed my bag and I walked about 200 to 300 yards to the parking lot, and then I decided to call 911, which was probably not smart, but I did. And I walked to my truck, and there was 2 guys standing there, and I told them I was having a heart attack. Would they stand there until the ambulance got there? And they looked scared, so I knew I must have looked bad. The only thing I could think of was to pray and ask God to get me to the hospital so I could see my wife and kid one more time. We got into the emergency room, and they got me right into the bed, and it was crazy amount of people in that room. And they said there was going to be a lot of people working on me. And the cardiologist came in and introduced himself, and that's when we were shaking hands, and I said, I'm going to go out now. And that's the last thing I remember. So I think we all need to understand the different signs. There's many different signs. I thought I was having back pain. It started behind my chest, and I started to try to crack my neck, because that normally makes that pain go away. And then the pain started to go down my left arm, so I knew at that point it was a heart attack. But thanks to the AHA, they're bringing out awareness that there's many things you can do to prevent heart attacks and stroke.